Daktari, a quick one. Karibuni tena to yet another one of these very exciting episodes of Daktari, a quick one. Kama ke, mimi wako, mupedwa, Dr. Nyadimu. And look who's back.
Hi guys, I'm back. It's your co-host, Dr. Leez Renske. Welcome, guys. Ignore his side eye. Ignore his side eye.
Bombastic side eye. Where have you been?
Life, man.
You've been missing in action.
Hey, but
for
we're
quite
back.
some time.
We're back. I think what matters is we're back, right?
We're back. We're back. Welcome back. You were missed.
Thank you.
Well, what have you been up to? What's new with Leez Renske?
Leez Renske is just doing philanthropical work.
Wow, you know that's for rich people, eh?
I think richness or wealthiness is a state of mind.
Is it?
Yeah.
Really?
Yeah.
So if I believe I'm rich, I'm rich?
Period. It starts with a frequency before an emotion. Yep. And then a reaction, and then action, and then manifestation. So.
Wow, you have a you have a sequence for it already.
Yeah.
So it starts with
frequency.
Frequency.
Yeah. So it's about frequency.
So what's frequency? What do you mean by frequency? Like a wavelength?
Yeah. Technically, exactly. You know how you have frequency cycles? Yeah, that's what it is. And so you would find that with the help of frequency, people that are not doing so well in life attract rich people just by being around rich people. Have you asked yourself why? No, I know it sounds crazy.
But why?
There's this thing where when frequency starts propelling emotion, you start acting like these rich people, even though you're not there yet. You start doing what they're doing.
Isn't that pretending?
Nah, it's like, let me give a good example that people could relate to. You know that one kid that wasn't so smart in class when you were like a top performer?
I was that one kid.
And then now let me tell you about your type then. There are these kids that are not so smart and they start hanging out, or their parents tell them, you need to hang out with the smarter one. Hang out with Liz. Liz is going to teach you stuff.
You are the smart one.
No, I mean, if you want to look at it.
Noted.
And then as you keep on hanging out with Liz, what happens?
You become smarter.
Your marks get better. And what changed?
You probably started behaving like the way Liz does. You started studying the way she does, things like that.
So before you started acting, which was the studying and behaving, it started with a frequency, which was a thought. Your mom had to say, go hang out with Liz. She could help you increase your science marks, so do better. And that's exactly what the science of manifestation looks like. Yeah.
I have friends who say who misuse this manifesting thing. They just wake up one day manifesting Dubai, and then the next day they're in Dubai. They had already planned. They already planned to go to Dubai. Everything was ready, but then they say manifesting, and then next thing you know,
I know that type. Those are the ones that tell you, hey, you ask, hey, have you studied for biology? Hey, man, I'm going to study a day before. Then the exam comes.
And they ace it.
And you guys were at the club together. Yeah. And then they ace it. So it then just happens.
So you hang out with rich people, you feel rich?
Yeah.
So you've been feeling rich all this time?
I've been feeling rich. Well, the way you said it. But yeah, I've been feeling rich.
Welcome back. I hope you'll buy me dinner once you're done here.
Yeah, in Dubai.
Well, that's pushing it, but okay.
Yeah. Anyway, how have you been?
I've been good. A couple of episodes of Daktari, a quick one here and there. Work, locums here and there. Yeah, kama kawaida. Working on something that I will tell you later.
Ooh. Yeah, you guys need to stay tuned and keep it on the lock because we have so many exciting things to tell you about.
Amazing. But today we want to talk about toxicity. Let's talk about toxicity. But before we continue about toxicity, short break. So toxicity. Liz, I know you've talked about this issue of toxicity on this channel. You've talked to me in person about it. ever since, back in the days of internship, that this person is toxic to me. And then I'm always, okay, I agree with you. Really.
We need to talk about that.
Yeah.
I feel like,
Yeah, it's quite a thing. Yesterday, we were having a big discussion on X. Are you on X?
Well, I am. I'm just not active.
You're not active.
Yeah. I'm part of the minority.
X is a very rough space if you're not used to it.
Apparently, it's the ghetto.
It's the ghetto.
Yeah.
People say they're telling each other truths when they're just bashing each other for no good reason. So anyway, we're on X, and then this medical officer makes a post saying that she asked an intern to perform a digital rectal exam on a patient, and the intern said no.
Oh,
I ain't doing that.
Oh.
Yep. Yeah. And then, so she posted it on X, and then it became a whole thing, other interns are on the side of the
joining
intern.
chat.
They're like, DRE is not important. You don't have to do a DRE. What is the importance of DRE? And all that. and all that. And yeah, so it ended up being a discussion on toxicity and how about seniors being overbearing on the interns, the juniors, and things like that. And my opinions are always a bit controversial.
As usual.
Because I'm like, okay, toxicity or just being held to account? What do you think? Is toxicity real?
Oh, yeah. I think it was you the other day that taught me about the right channel to take when you find you're in a toxic environment. Ideally, I feel like there are two types of people in terms of responding to toxicity. There are those like you who just ride with the wave, and then there are those like the intern who need to speak their minds out and try and correct the wrongs. I do think DREs are relatively important because it is. They diagnose so many conditions. But I think we don't know what happened, but probably the approach of the MO triggered something. Because an intern knows they're supposed to learn.
They do.
They know that, well, we didn't know it, but we were in the ghetto. And once we realized that, life is tough during internship, we just knew we had to finish. But then there are those who just wouldn't tolerate shit from people, like this one. And I think workplace toxicity could be identified based on performance of the team on the ground. It's not necessarily about just superiors. It's also about like the interns. Why have they stopped doing what they used to do? Why don't they enjoy coming to work anymore? Because we went through a phase where, internship, we crashed, and had the environment. Well, we had an amazing, supportive.
I think
med soup.
I loved my internship. In a way, I enjoyed. I did. Of course, hitches are always there. They're expected. But personally, I whenever I look back to my internship, I'm like, that was a nice experience. I mean, I never look at my internship like, that consultant, that MO. I'm just like, okay, this happened, taught me this. It was nice in general. That's for me. Yeah, and even some intern was asking me to explain how come it was so... like I didn't find trouble, and my conclusion was like, okay, first of all, listen to your seniors. Like,
Doc, we will not even try and have you say that.
No, it's important to listen to your seniors. What do you mean?
The 5 Ps?
No, forget about that.
Yeah.
But we'll come to that. But I think, number one, if you listen to your seniors, and then you're there.
Yeah.
Like, for example, during ward rounds, you're not late. You know all your patients. You've clerked the new ones. If there's any investigations, maybe from yesterday, you've done them, and you know them. If there's anything you could have corrected, you've corrected. Then you just present wherever you are. You don't need a lot of knowledge. You don't need a lot of knowledge. And I supervise interns at the moment.
You see, your millennial doctors... are where it's at right now. They understand the struggles, and so they're approaching medicine differently. And to be honest, I high-key wish that maybe older older consultants could create more space for millennial consultants, because there's a connection they have with interns that older consultants don't have. There's the empathy. There's the I was just here not too long ago. About the knowledge, though, I think it depends on the department, because we both know IMED was not an option to go without knowledge and do ward rounds and see the consultant there and not have any idea, because let me tell you what happens. So we did our internship in Makindu, and ideally, whenever you have a patient, it starts with the nurse. Oh, have you given the patient drug? This. Let me get the T-sheet. You get the T-sheet. Then the drug that was written in the T-sheet is not treating the condition that the patient was admitted for, or
so it's a wrong prescription,
or the patient has been on antibiotics for like 5 days, IVs, and there's no improvement, and we're just CT management. Looking back now, I could see why that would, pinch a nerve. But
you could see why your consultant would be
mad.
Cross with you.
Yeah, but after the nurse, who does the consultant go to?
The
intern. Now the consultant will move from...
Wait, your consultant started with the nurse?
No, I mean, as in just give an example. Like typically you guys are doing a ward round, or you're having a ward round.
From experience, if there's an intern.
Okay, I was the only intern until you joined.
Yeah.
Yeah. Well, and then I had other interns prior, so I was alone in obs guy. But what I mean is, like, if you guys are doing a ward round, for example, a patient could have, let's say, diabetes or something, right? And you have not changed the insulin dose or something, and your FBS is constantly high. Apart from the dosage of the drug and addressing it with the nurse, the next person that's on the hot seat is the intern. We move from talking about the drug to talking about the pathophysiology of the condition. If the intern does not answer, who is next? It's us, the MOs.
Yeah.
A consultant would never ask another consultant.
True.
True. And I think maybe during that moment when we are messing up, it probably just causes a build-up, and then the intern gets all the backlash.
What I think about, there's always a first impression, especially when you join a new department. So if you're an intern and you've just come,
right?
The first question is, because I was saying I supervise interns a bit here and there when consoles are not available.
Right.
So because they're doing my work,
yeah.
So I supervise them. So the first thing when a new intern comes is to gauge them. You gauge their level of knowledge. You gauge their level of
their speed,
dedication, their
education.
Exactly. And from the few years I've done it, I can always tell an intern who's gonna be most reliable, an intern who's gonna be trouble, an intern who's just gonna flow through it. This is both MOs and COs, MOIs and COIs. You can just see them. So an intern who comes in, you've come in the first day and they're, hi doc, we've already done a pre-round, this. I already know, my favorite.
Yeah.
So this one is gonna do my work.
Yeah.
This one is gonna deliver, and you're already willing to teach them. But then there's one who will join the round in the middle. You ask them, even if they're presenting a patient, they don't really know that patient very well. The history is just showed. You can just see they're trying to fill gaps. They're guessing things, and you already know this one's going to be trouble. We're going to have to fight. So I get what you're saying, that millennial consultants are, understand these interns. But my feeling is this understanding gives a lot of leeway. Because now we become friends.
Oh no, millennial consultants do not befriend you.
Oh, they do?
Oh no, they don't.
What do you mean?
They are approachable.
But that's friendly, right?
Friendly is not friendship. You being friendly doesn't make us even close to acquaintances.
But if I can be able to go and sit with a consultant and we're just talking stories. Now we were talking about, random things, and we're sitting there, both of us taking tea with a consultant. That's a friendly consultant.
But Yes,
Not
that's
particularly
a friendly.
your friend
Right.
per se, but
Yeah.
as you say, approachable. But that what does that do to the intern? What does that do to your mindset?
To be honest, it also makes you a better intern more than it making you lazy, because you are less liable to make mistakes if you are able to talk to a doctor and you're stuck and you are frustrated. We had a surgeon in Makindu. Anytime, even 3 a.m, he would even come and put the cannulas himself.
Yeah.
He made me enjoy surgery. I could read without even like being asked to read. But then if your consultant isn't approachable and they're not frequently there, I'm basically teaching myself. And that's what happens in internship. Let's not lie. Majority of the knowledge you have is because you taught yourself, and it has only stuck because now you're experienced. It's not because, oh, you went to Makindu and so Makindu gave you the whole book. Oh, hell nah. It's because you just had to soldier on. And we understand those struggles, because when you're on the ground, you are running a whole department that you don't know shit about.
But then you learn on the job.
Exactly. But who are you learning from if there are no consultants available?
But, available...
Festus, you know
ground.
what I mean.
I know what you
This
mean.
is not politically correct.
No, I know
or
what
wrong.
I know what you mean.
Right.
I know what you mean by being available.
Right.
But then, I think as a doctor, when you're practicing as a medical officer, you do not have a consultant down there with you, readily there. You'll first of all see your patient. You can prescribe. You can make treatment, do orders, and all that. You'll only call in the consultant if you need them.
I beg to differ. I did internship twice in 2 different countries. 2018 Botswana, and then here. And I will tell you for free, toxicity is toxicity. Many people want to be present only when their bosses are around. But on the ground, they're acting busy. Let's just talk about it. They're acting busy. And then once they're done with work, you can't even approach them. Just the thought to say, hey, doc, this patient is day 2 post-CS. Should we start soft feeds? Just the thought even just gives you like tickles down your spine. And this doctor is treating themselves like a consultant, and they're not a consultant yet. Let's talk about it. You're an MO. Yeah. The confidence an MO has is only there after they finish their internship. I'll tell you, I knew what was going on in internship, but it all made sense after internship because I was alone. What I mean is we would give drugs that were available.
Because it's a resource-limited center. You're working in a sub-county
resource-limited center. Exactly. I also worked at a major referral hospital. You give drugs that you have, right? But the problem comes in when, as an intern, you're used to that cycle. Amoxicillin, fluoxacillin, metronidazole, paracetamol, repeat. But you don't know what it's really like out there. Like, you don't know that you can give meropenem because most patients can't afford it. You don't know that you can do culture and sensitivity for urine because resources.
But then that's where a good consultant comes in, because even where I went to school, we knew that all we have in this hospital is ceftriaxone and Expen.
And Genta.
Yeah, but then the consultant would tell us, and this is very common in hospitals, public hospital setups. We usually use this phrase, in an ideal setup. In an ideal setup, I would do this. In an ideal setup, I would do that. In an ideal setup, I would do this. So a good consultant would say, in an ideal setup, remember you can do cultures. Here we can't, but if you are out there, we would do cultures. And then, so you know that, we are not able to do them here. But if I ever find myself working for Aga Khan or working for, Mata or something, I can do cultures.
Yes, but that doesn't make you the best version of yourself yet, because that exposure was a bit limited.
Yeah, and that actually, I think that's a big deal in this country, because the internship experience is not commensurate. It does not equal. It does not parallel. To what is out here. Because tell me, Dr. Leez Renske.
Because
because I remember I was there. What
Yeah.
was that one thing that you were really taught how to do in internship?
To be very honest, everything neonatology.
Apart from that?
CSs.
CSs.
We had the best MO that
Exactly.
took her time.
Exactly.
I was
So-
in gynae in another department. We didn't have an MO that took her time.
All right. So
Yeah.
you were taught to do CSS. How
Yeah.
many CSS have you done since you finished your internship?
I'm in a private
Yeah.
setting.
Exactly. You've
But
done.
I'll remember
No, but the point is,
Yeah.
in all these years, you haven't done as much.
as many as internship. Yeah.
As long as you are not in a public hospital, you're not going to practice medicine the way you were taught in internship. Yeah, it's going to be totally different because you'll come out here. In internship, we don't rotate in outpatient.
We do.
You rotate in outpatient.
Yeah.
Casualty is
Yeah.
not outpatient.
Casualty is outpatient.
No!
It's OPD.
Casualty is emergency.
No, A&D is emergency.
A&D and casualty are the same.
Oh, hell nah.
What do you mean?
No. Think about it. Casual. What's a casual? They're not meant to
Casualty,
stay
people
there.
who are casualties were rushed to
Or
hospital.
maybe we
Casualty
could say
means
casualty is the whole department and it's divided into OPD
okay.
and A&D.
All right.
Yeah, I think
Let-
that makes sense. But it depends on where you studied, I guess.
All right. Okay. So let's say, yeah. So some people are in A&D. Okay, we rotated in A&D because you'd be called there to, start whatever. And then OPD. We never rotated, seeing those day cases, people who've just come with a flu, people who've come for a refill, somebody with a mild headache. We never rotated there, did we?
No, that was, you're right.
But then most of us, once you've finished, those are the first jobs you get. Jobs that do not need you to do CS, jobs that do not need you to do, jobs that require you to be in OPD, yet you didn't acquire those skills. You learn them on the job. So that's why you get that feeling that now I'm learning on the job because you're working in a totally different setup.
Well, I kind of feel like it depends on the consultant that's in the department. Where I worked, the obs guy would always be like, hey, I'm going for CS. If you're free, feel free to join. Or you can just, it wasn't like I'll do the operation, but it was more like come in and then let's see where you're at, because we've never had any experience doing a CS together compared to Makindu, where the MO already knew and had confidence in our CS skills because she witnessed so many others.
This other place you're saying is where?
Oh, no names.
Oh.
No names.
This is after your internship?
This is after my internship.
okay.
Yeah. Even just same with a relative who also would do CSs. Hey, are you free? Let's go do it together. It was that easy. But I feel like I get what you mean. And even in casualty, I feel like there are so many emergencies we can actually treat and not just refer. And that gives true satisfaction, knowing that I am doing something to the best of my ability and there's progress in this patient's journey and they're getting better, versus you're watching someone and you're not able to do anything. You have to refer and you know what the prognosis is looking like. It's just different.
On that, I think they just need to improve the internship centers, make them more holistic. They should reflect what is actually out here.
I also do feel that internship mentors need a bit of mental health training to factor in the mental health of their interns. Because I kind of feel like had I had a better mentor, it would be easier to air out my grievances. But sometimes you'd find that work-life balance just gets in the way. Like there's an imbalance. You have things going on, but you're still expected to show up every day. And you're liable to make more mistakes because you're fatigued. So I think that's something that could change. The same way they introduced it into our internship program, I think. MOs like you should get trained.
It's not just MOs. All teachers, all people who teach should be taught how to teach. Teaching is not natural. It's a skill that needs to be learned. Yeah. And personally, I have been called toxic.
Oh,
I have been called toxic.
I didn't know you had the ops when.
I've been called toxic.
All right.
Mimi nimeitwa toxic MO. Toxic senior.
Have you ever taken time to find out what makes you toxic?
I went, I put my ears on the ground. It's like, okay, why? Because I'm like, such a vibe. Why would anyone think I'm toxic? Yeah, but then it just boils down. What I think, and this might sound harsh and rude, and we all grow up differently. And we were saying with Dr. Rain the other day when he was here that as generations progress, then people are getting softer and softer.
Yep.
In a way. So the hardships that my parents had to endure are not the same as the hardships that I had to endure. I had it easier compared to them. And my children will have it easier. So
if you work hard.
If I work hard. But even if I don't, they're likely to still have it easier. It's unlikely to regress because even society in general is getting better. So it's very unlikely to regress.
The economy is also getting tougher. And I think that's something people need to talk about. I beg to differ. I mean, I agree, but I also beg to differ on that topic. Because a parent that's a boomer parent looking at their millennial child is like, damn, I've taken you to med school. That's a privilege I never had. That was a job that only the rich could afford, And now you're choosing to not do medicine the way I want you to do medicine. Because they have their vision of what a great doctor looks like, and you have your vision of what your medical journey looks like. Already there's a conflict of interest, right? But what they don't understand is the cost of a house during their time versus the cost of a house right now is completely different.
But there's more money.
No, not in circulation. Life is harder. There's more tax. So if a car would cost 200K, that same car is costing like 1.8 M. How many hours of work do you have to endure to make that 1.8 M? You don't have to dwell in inheritance. They're still alive. I mean, they're still alive. Think about it. So same thing with the child and the parent. Our assumption is, they're a parent. They've done this before. And so you put pressure on them having expectations because they've done this before. But what you don't realize is they're human. It's their first time being a parent. They don't know shit about shit. They're learning as they go too. So it's just...
So the same, you want to say the same applies to the younger doctors?
Yes, but I want to talk about that DRE.
Forget the DRE. We'll come to the DRE. Because what I want is this toxicity thing. The point I was trying to make is things that I might think, like, if I come to you're my junior, for example, you're an intern. I'm the AMO in the department, and I'm doing a daily round. The consultant hasn't even come. You're my junior, and we said yesterday in the round, this patient needs an ultrasound.
Right.
And I left you in the ward.
Right.
Yeah?
Right.
And then I come tomorrow, there's no ultrasound.
Right.
I asked you, where is the ultrasound of this patient? Why have you not done an ultrasound? This is wrong. I mean, this patient is a human being. They do not enjoy being here. The faster we treat them, the faster they get out. Please, please, please make sure you do this ultrasound. And, I tell you, and you did the same yesterday, and the other patient again, and we lost that patient because of you, because you didn't do that.
That's toxic. Already, that's toxic.
How is it toxic? Because, we said do it. You said you would do it. You never told me I'm not able to do it.
Right.
But then we've come here, and you've not done it.
Okay. I understand.
What should I, as the so-called toxic senior, should I be like, you didn't do the ultrasound? So with all pure love, we're supposed to do ultrasounds. But just because you didn't do it doesn't make you a bad doctor. But next time, just do it, okay? And then I come tomorrow, you still didn't do it. You still haven't done this ultrasound from 2 days ago. Okay. It's still, you're not bad yet. You're good. In fact, because you did, the patient is still okay. Of course, now they're on oxygen, and they were not, and we still don't know what's going on in the abdomen. Right. But you're still okay.
Right.
Will you be able to do it today? Day 3.
Don't worry. We can try tomorrow again.
Is that what we're supposed to do?
I think the first problem with toxicity, or the first thing, would be teamwork. the fact that you don't work as a team already makes you toxic, because we understand that medicine requires teamwork.
It does.
Secondly, the difference between a toxic MO stroke consultant and a non-toxic MO stroke consultant is you would either be self-sufficient. You know, you see those consultants that do their ward rounds alone.
Yeah.
They get their own gloves. If you want to join them, cool. If you don't want to join them, cool.
And you were talking about the consultant in Makindu, the surgeon.
Yes.
Who would come and fix a line.
Yeah.
I would really get pissed when he did that.
Oh,
Personally, I never liked that. You know, he comes. I know I'm on the ground because I was really interested in surgery. So I want to prepare the patient to go to theater and possibly join so that I can learn how to do that hernia or that X-lap. But then the guy comes, he prepares the patient himself, does everything himself, takes the patient to theater. I think that would be more toxic than the person who wants, because clearly this person doesn't want me to learn.
I beg to differ. I don't know what happened during your interaction with him.
It was okay because I would be there, but I would always notice that if I'm not around, he wouldn't bother making sure that I'm there.
Oh, so that faith or trust in you to get things done within
like
him.
It's
Okay,
not there.
that makes sense. But for me, I think
he was not, like, you call him, he's there.
Food, he's there.
You need him, he's there.
Sorry.
Lunch, he'll give.
He's there. Definitely.
Like, he'll, but if you're not there, he'll go on without you.
I understand. Then there was the other one. Did you meet the other one?
Which other one? I didn't meet another.
We had two. So I liked his approach only because whenever we were required to go to theater and I was on call, I was seeing more than one patient at the same time that was a surgical case. So there was a time when the Maasais were fighting against the Kambas. They were using spears. We had to insert at least 3 or 4 chest tubes, polytrauma, head trauma, declining GCS. And he heard the ambulance all the way from... I didn't call him. Okay, I didn't call him. And also, I want to let you know that I feel like depending on where you studied, it matters. Like, you guys had a consultant that would say, in the ideal setup, right? And then we learned in the ideal setup, but we were brought into an non-ideal setup. Non-ideal setup. And it was just like, what the fuck, you know? But now it's more like when he came, I felt even more confident. He's like, okay, you get this, I'll get this. Let's do it together.
It's a teamwork.
It's teamwork. It moved
He's
from...
not all bossy and just telling you to do everything.
It moved from him inserting the first chest tube to me inserting the second to him inserting the third as I was doing the fourth. That confidence goes a long way.
Okay.
And I know most people, especially in private setups, wouldn't get to do that, but there are consultants out there that would gladly.
Yes.
As long as they observe and, monitor, it's okay.
I saw on X, I saw another intern complaining on this thread, the whole from the DRE thing.
Yeah.
And he was like, he was alikuwa kwa Kiswahili tunasema alikuwa anazua rapture.
Hey.
So he was saying that there is these MOs who are coming here on X to say that interns of nowadays are, lazy and they're not up to speed. They're the same ones who show up in the ward, do a few hours of ward round, and leave all the work for us.
That's the toxicity part.
How is that toxicity?
That's not teamwork.
I want you to learn.
Okay.
How will you learn if I'm there? Because
the same way we learned CSS when our MO was there.
But then at some point, they leave it to you.
True, but then you want to have that faith in that person before you leave it to them. Like, I wouldn't leave an intern to just do an ultrasound. I would rather ask them. By lunchtime, I'm going to check on the system. Has this ultrasound been ordered? Because at the end of the day, I'm getting the backlash. But I think the other thing would be, as an MO, one thing that I did different when I was also taking care of the interns is I made sure that at the beginning of everything, they knew and imagined that this is a patient. this is a 50-something-year-old man. Think of a 50-something-year-old man in your life that matters. Had a doctor treated this patient the way you treated them, how would that make you feel with your medical knowledge? Yeah. So everything you do, if you're going to do it right and do it to the end. If you're not going to do it, then I don't know what you're expecting to get from internship. Internship is not fun. It's not meant to be fun. It's not meant to be...
a walk in the park.
It's not. I don't know how he had a fantastic experience. I think he's 1 in 10. Facts, no printer, 1 in 10.
No, I actually enjoyed mine. And I think after you left, I think we enjoyed internship.
Yeah, like you're a group.
Yeah, we were a group, and I found myself with this group, and I'd advise an intern there, just find your niche, because even the interns I've seen that actually enjoy their rotation, they do it as a group. You rotate like 2 of you. You have your best friend there. Enjoy with them. So I wasn't with my friends.
I was gonna say you were alone.
Yeah, but they were somewhere in the vicinity. Like if they had an interesting patient in IMED,
they would call.
Would go discuss about it.
If you have trouble cannulating,
they would call.
Hey doc, help me.
Yeah. If we had and I remember chest tubes, we were big on chest tubes. We would always call each other. Oh, umefanya ngapi? Maze kuna ingine wewe kuja ufanye. Hujaifanya chest tube. You come do it, and all that,
right?
Because I remember we were taught as a group to do a chest tube. I wasn't even in surgery at the time. I was, but when we had an opportunity to do a chest tube, the MO called all of us and was like, "This is how we do it." Okay, and then from there we never needed an MO again. We were 3.
Yeah,
we'd call each other, come do this, and they do, I do. And even when I was in surgery and they were not, I would still call them, guys, there's a chest tube there, please. I'm a bit held up. Could do it. And
so rule number 1, don't go alone.
Yeah, get your friends.
I went alone. Actually, we were 3 and they just disappeared and I was alone in a village. Yeah, but I agree with you. Get friends. Make friends.
Get friends, and I think internship. If it goes well, it's meant to be enjoyed. And the other thing, also I talked to a lot of guys. So there's an intern friend of mine who went to. She went to an internship. This is a Gen Z, and this is why I say this. These guys are a bit too soft. She went to a mission hospital. Yeah. And sorry for ratting you, I won't say your name though. She went to a mission hospital and I was just checking on her and she was like, I changed from that place. And I'm like, why? And she's like, have you ever had this employer who, and the exact words, have you ever had this employer who is, thinks they're doing you a favor by employing you?
I'm offended for the employer.
I'm like, well, okay, I think so, but they want you to be grateful because they've given you a job. And I'm like, you don't want to be grateful?
Is it an option?
So they felt that the employer was what's the word? I mean...
Yeah.
Yeah, I mean, to me it was such a...
toxic, quote unquote.
It was such a petty reason to change from... And in my opinion, it was a nice internship place because that the employer is taking you for not granted, really, is feeling they're too good for you or something. I don't know.
Or you're unappreciated in that workspace, or... I could see where you're coming from.
Is it? So yeah, I feel these guys are too soft.
Okay. So let me explain the non-toxic way of saying that. So I feel if you really, really, really want to see your true endurance and resilience, just see it through to the end. It doesn't make you any better if you keep moving from one hospital to the other. It's actually like slowing you down.
Yeah.
You never know. I feel like mission hospitals are the best place to learn. Like out of you guys have everything.
They do.
You even have super specialists, fellows, something. Like you You're not alone.
And they're super nice, because I was talking to Dr. The episode is down here. I was talking to Dr. Arunga Bonke, and he went to Kijabe Mission. And he had all nice things. He said, these guys were so nice. The consultants were very soft on me. They supported me when we were not being paid. They gave us a tip. And I'm like, what?
That's the errors were different though.
It was last year.
Oh.
Yeah. I'm like, that's the place to be.
In this economy.
I know.
Shout out to you, consultants.
At the same time, you hear some other interns saying that this mission hospital was mean to me and I had to leave. I'm like, what?
Okay, so what I think is this. We are two doctors that are going to give you unpopular opinions about internship. Just advise, like top 5 things. We'll bounce it off each other. But rule number 1, do not be choosy, because internship is not the end of the road.
It's just 1 year.
It's literally just, other countries have it for 2.5 years, like Malawi.
What?
Yes. I have a friend who did it for 2.5 years. Zambia, 2 years.
That is Internship Pro Max.
You leave as a consultant.
You do. I mean, what? 2 years is a long time.
Yeah. So that's number 1. Number 2, just put yourself out there. If you're not going to be putting yourself out there, no one is going to follow you and say, hey, doc,
yes.
we have chest tube insertions. Would you like to show up?
Exactly.
And then you end up in a hospital alone and people are like, looking at you like, yo, what's up? Are you going to
this,
exactly? And that's a problem. Would you like to give rule number 3?
And just maybe on that, I've seen such interns who they are not present. They are not there, like, you know, because maybe if it's casualty, they'll call me because I'm usually the MO there. I'll be like, okay, doc, we have a suprapubic for insertion here. Would you come and do it? I'm like, have you looked for the intern? Like, we called him in, isn't picking. I have no problem putting a suprapubic. It's you that needs the experience. So if you're not there, my friend, and then go do it. And then some interns will feel like by me telling them to go do it, I want them to do my job for me. I have no problem. I can do 10 in a row. But I want you to learn, because you're there to learn. Because at the end of the day, we are releasing you to the unsuspecting public.
That's rule number 3. You won't get your book signed, your logbook signed, if you're not getting shit done. And it would come off as toxic, but it's for your own good. So you have to show up and be present. Because if you're not there, he won't sign for you. He won't.
And I think
rule number
4, and this one I'll draw from what a guest of ours once said to me. When I asked him categorically about this toxicity thing, and he said, my friend, you're too junior. No one cares about you.
Period.
You're not that important.
That's true.
You know, like, I'm a consultant with over maybe even 10 years, 20 years experience in this field. I've seen all those years I've been seeing interns every year. What makes you think you're so special that I'm here to pinpoint you and say, now I will make sure I'll pin you down. So, and this was Dr. Oburu, the author. He said, you're not that important. Get over yourself.
That's rule number 5. Hospital beef is not taken outside. So if you have a problem with someone, they're not there for you. You guys have a common interest, and that's the patient and the wellness of your patient. So if you start to personalize things, you will leave with...
Don't personalize. Because that guy will not remember you in 2 years.
Oh, no.
He will not. So
even 2 months, he will forget that he was mad at you.
The minute you're thinking, oh, he hates me. No, nobody hates you.
Nobody hates you. Just get your work done and do it right, and it will work.
And at the end of the day, you know, I was talking to a nurse today, and and I told her I'm going to have a conversation about toxicity. She's a big fan. Shout out. She's called, what's her name? Oh my God, her name is lost.
You better check him after this episode.
So her name is Doreen. Yeah, and she was telling me about the toxicity that now nurses.
Now that is toxic. You see, if classification of toxic.
Like, what are interns complaining? I mean, what?
Okay, so now the nurses have it the worst.
Yeah.
To be honest, they're just being bullied. I'll just put it out there. No matter where I've gone, there's hierarchy, and that matters to all nurses.
Yeah.
And fine, there are matrons that are really nice, but those are the ones that are not dealing with you. It's the ones that are in the ward. The in charges of the ward. They're not matrons. They're
in charge, just there.
Those are the ones that will need to push you to your extreme. And when I think about it, I think it was just how they were also raised and how their journey went. If you don't believe in a system where you have to toughen up and you want to become a nurse, reconsider. Politely reconsider.
Yeah.
It's rough.
But and just even thinking about, because from what Doreen was saying, that you'll be even suspended for doing something that you were supposed to do, and know that anything went wrong. I'm like, what?
You can't leave the gate during work hours.
You can't.
You can't leave 20 minutes earlier. Your sick offs are a bit limited because there's always shortage of stuff. It's a bit hard, and we need to appreciate nurses in our circles and our lives.
And I think nurses go through a lot, and the toxicity makes it even worse. Yeah, and especially in Kenya, where I think people feel threatened because just maybe to make a comparison, for doctors, you can always climb the ladder and go higher. So I won't really be, if I'm a consultant, I'm not really worried that my junior is going to come and take my place. But in nursing, there's
inferiority complex is what it's called.
Yes, the spaces might feel a bit limited, and I might feel that if this nurse outshines me, she might replace me very soon. And sometimes the in-charge nurse can be downgraded to a bedside nurse. Just like that. There's no that you're qualified to be an in charge. It's usually experience and maybe how good you are. So I feel, that probably there is that fear among the leaders. I don't know. We'll call them.
That's where the toxicity comes from.
Yeah. We'll have nurses here soon, and they'll tell us all this about the toxicity in the nursing field.
I also feel like there's an element of toxicity when there's inferiority complex.
Yeah.
And that's something we don't talk about. Even between consultants and interns. Having to say you went to school at a particular place is already like, so you think we don't have... I've had several consultants here ask me, so you think we don't have schools in Kenya? I've also had consultants tell me, you take your English elsewhere where people could hear you speak because you're speaking too much English. I'm not going to mention names, but I'm going to drag a few situations and just place them here. Only because I want people to understand, as long as you're doing your job correctly, not many people would have a problem with you. But if you're doing your job correctly and there's that one person having a problem with you, you should go through the right channels if it's affecting your productivity at work and likely going to cost a life at your expense, So it's more like, if you feel like you're constantly being bullied, hospitals have created channels where you can easily communicate. Talk about it instead of just going on X. Address it with the person, and if you feel that they're not listening to you, then you could escalate it. Don't just rush to the DMS or social media. Like, express yourself and say, hey, Dr. So-and-so, could we have a word? If Dr. So-and-so has been spoken to and they keep doing what they're doing, now take it up again. Take it up a notch. Keep going. But just make sure whenever you keep messing up because of toxic work culture, it's not the toxicity that counts. It's the fact that you lost a patient and that costs you your whole license, your whole career. So just get that in check. Just be open. You don't have to be rude about it. You can still maintain respect. And again, bear in mind that when a doctor is asking you to do something, it's because they want you to learn. It's not always because they're trying to bully you.
Yeah, true.
Yeah?
And I don't think anybody is trying to bully another one. But then, the other thing, just to add on what you've said, the other thing that I think we all need to learn, and I think for me it's kind of helped me a bit, is the psychology, human psychology. You need to learn to understand the people you're dealing with. Because there are people who have fragile egos. Yeah, there are people who, they want, to feel big.
Superiority complex.
Yeah, and it's not wrong. They
deserved it.
People come from different backgrounds. People have been raised differently. So if you realize maybe somebody has that inferiority complex, you're not going to change them.
No.
Learn how to handle them. Learn, if especially they're your seniors, yeah. And I'm not saying you start, they call it bootlicking. I'm not saying you do that. But then there are books that you can read on how to handle these people. If you go read the Laws of Human Nature, read 48 Laws of Power, they'll tell you how to handle such people.
Or podcasts.
Or listen to podcasts. Or listen to the guys. There's so many guys on. If you listen to Robert Greene himself, he does a lot. Go to TikTok. Look for Robert Greene. Scroll Robert Greene. Robert Greene will tell you how to handle every character you come across.
There's Mel Robbins too. Scroll Mel Robbins. She will take you through everything, like people you will handle, or you'll bump into during financial problems at workplaces, friendship, everything. And I think you'll just make it through.
Yeah, and they'll tell you, you'll learn when to humble, you'll learn when to be at same level, you learn to read the room, and you'll learn, and this brings me to what you were saying about that, about you said there are 5 P's.
Yeah, 5 P's. 5 T's. 5
T's of PPH.
PPH.
And I'll learn when to speak up for yourself. Like when shit hits the road, and you've tried everything, learn how to say, Daktari, no.
Yeah.
Please.
This is evidence-based medicine. Get your protocols and prove your point respectfully.
Yeah. Well, if you realize that, okay, now this person, I've tried everything. Just speak up. And, sometimes you're respected. If you feel that you're being disrespected and you speak up, it's like men. Najua wanaume wanasema piganeni mheshimiane.
But do men speak up?
No, that's just to bullies. Sometimes they do.
Sometimes.
Yeah, men speak up to bullies. Real men do.
Okay. So moving on, we have a section in our podcast where we shall be reading some stories and we'll give you our feedback on that. These are not facts. Their opinions. So don't come at us telling us how we said A, B, C, D, E. Why hasn't A, B, C, D, E happened? We're just letting you know how we feel.
Yeah, these are experiences. So we take a tiny break?
Yeah, let's take a break.
Then we'll be right back.
Hey.
Daktari, a quick one. Welcome back to part 2 of Toxicity. And Dr. Leez, you have a very interesting story from Reddit.
Yes. So it's a story about an intern in SA. So I'm just going to read it. So on the 12th of May 2025, a tragedy unfolded at Prince Mshenyeni Memorial Hospital in the pediatrics department. A medical intern, an only child and the pride of his family from the rural Eastern Cape, lost his life under deeply troubling circumstances. He was recently diagnosed with diabetes. The intern became acutely ill the week before, experiencing significant hypotension and 2 episodes of collapse. He took a few days off sick leave and in attempt to recover, but did not improve. So despite his visibility and him visibly deteriorating, the supervising consultant reportedly threatened him with repeating the rotation again. So colleagues recall that he no longer looked like his usual vibrant self. Once cheerful and full of life, he had grown visibly thinner, pale, and weak. Still, he returned to work under pressure. Witnesses say that throughout the day, it was clear that he was unwell, and tragically, he collapsed during the shift and drew his final breath, forced to work while dangerously ill. His story is not an isolated one. Interns in this department have long endured mistreatment and often denied even bereavement leave after losing loved ones. This culture of fear, coercion, and inhuman expectations continues and is unchecked. As a medical officer who knew him personally, I can attest that he was respectful, diligent, and he was a kind young man. His death was not inevitable, but it was preventable. A bright future, a family's only hope, has been cruelly extinguished.
Very sad. And this is down south.
Yeah. It was this month.
This month. We've lost quite a number of interns ourselves as a country. Yeah. Especially in the recent past. Last year. This year also.
This year as well.
Yeah, we've lost quite a number, and what I would say, especially for that story particularly, because some of ours had been due to depression, and they took their own lives. But this one particularly is a sick person. And the only thing I would say, my friend, those patients will still be there tomorrow.
Rule number 6.
That word will always be there. You even with or without you. So take care of you first. My friend, if you're unwell, you're unwell.
I think it's different though.
Stay away. Don't even wait for don't wait for the consultant's opinion. Doc, I'm not feeling well today. I will not be able to make it, full stop.
You have the right to health.
Yeah.
It's a sustainable developmental goal. And no one should tell you you're not sick. And I speak out of experience because I've had several experiences where you'd be unwell and you're threatened because you're told you're not performing well. We're going to take you back another cycle. That's not okay. Exactly as Doc said, if you need a sick off to prove you're sick, then go get seen. But take that time off because life will move on. Regardless. As soon as, God forbid, if anything happens today, tomorrow they're employing a new person and they'll just be like, oh, he or she was a...
You just post a very moving message and, is your life just worth a message? No. It's worth much, much more. So if you're unwell, my friend, you're unwell. And of course, we know there are tricks that, maybe interns will try pull, and there are those who will always say, oh, I'm sick for this and that. And when they're not, then you meet them. I've seen this. They tell you they're sick. You meet them in a club later. And it happens.
It's like, it
happens. But if you're actually genuinely sick, you are.
Yeah.
And to maybe the seniors, if somebody asks to be away, let them be. Let them be, because I think even being drained. That's why I never deny when patients come and asking for a sick off, that I'm just exhausted. I think I need a break from work. I understand, because it can be draining.
When you go to your boss and you say, hey, I'm sick only because I'm exhausted from work,
your boss might not understand.
Your boss will not, don't use the word might, your boss will not understand. Fatigue is part of ICD-10. It's an actual diagnosis.
It is.
You don't need to start vomiting for you to show you're sick, And I want to also just sympathize with the family. And we could just take a moment to appreciate one of us. A moment of silence would be great. And also, I would like to encourage other supervisors to take mental health a bit more seriously, especially in Kenya. It would be important for us to come up with some sort of structure that allows interns to speak out beyond the walls of their hospital and not feel like they are oppressed or not willing to work because they go through real life problems. There are many doctors out there that don't have food to eat and still show up every day with the little amount they have. The assumption that life is good because you're a medic or you're a nurse or you're a clinical officer or pharmacist is not the reality of things. It's tough out here. Just be kind. Just be kind. That's all I have to say.
To each other.
To each other.
Tupendane.
And if you have a colleague that's unwell and you're able to stand in for them, just do it. Unity is everything in medicine. I admire how nurses stand in for each other. Nurse so-and-so is sick. Okay. Or they made a mistake. They'll come and they'll be like, okay, this was the issue.
Let's edit. Let's unplug the page.
Let's start again. We did this wrong. We could never do that. Our egos don't allow us to do that. And so if we could remember that we are human before we are doctors, damn, it will go a long way.
Amen.
Okay, so we are wrapping our episode up.
Yeah. But before we wrap it up, you've mentioned something. We are human before we are doctors. One thing, and this I would really like to bring it up. It's a thing that has always been on my mind. One thing that is very key to a human, and Sigmund Freud. Sigmund Freud. Is it Freud or Freud? That one. He has the hierarchy of needs. Yeah. And in the hierarchy of needs, the topmost, what is it? In a hospital setup? No. In a human needs. We have the
water,
basic needs, water, food, and shelter.
Yeah.
And there is love and compassion.
Yeah.
And blah, 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 blah.
Yeah.
What's the highest thing?
Breath. You need to breathe. I don't know.
It's self-actualization.
Oh.
Yeah, it's self-actualization.
Oh, wow, that makes sense.
When you've achieved all you've achieved, you've done everything, and all you need is to feel that you actually made a difference. To feel that, I actually matter.
So that even just reminded me. We would like to appreciate doctors that actually made a difference. If they made a difference in your family, in your community, and they did it well. And so we have this upcoming award show, or just an award, where we shall be allowing the public to nominate doctors that made a change in their lives. And it's not a competition, it's just appreciation. And it goes a very long way to appreciate somebody who has been so selfless throughout their journey.
Exactly.
Because not many doctors are great doctors, to be honest, but there are those who do their best, and you see it.
Yeah, there are people who actually just stand out. They do extraordinary things. You know, there's, and it's not just about treating patients.
Right.
There are people who teach us. We're here talking about toxicity, but there are teachers out there who actually teach you so well, and you're like, oh my God. And all of us go through their hands, and they've taught for many years, and it's just good to say that Daktari, or nurse, or dentist,
or pharmacist, or clinical officer,
we see you.
We appreciate you.
We appreciate you for what you've done. And there are people who've led so passionately. Like the changes we're enjoying now, as members of KMPDU, even the salary we get is not the same as it was some years ago. And there are leaders in the union who are medics who made sure that happens.
And the board too.
Yeah.
Yeah.
So we're looking to just get your opinion on who actually you think deserves this recognition and this award. And we just tell them, asante, we see you, keep doing what you're doing.
Your work hasn't gone in vain.
Your work has been seen and it's appreciated. Because somebody's mentioned that doctors rarely retire. Why? Some people are not retiring because they've not felt that thing, that there's that feeling you get.
Yeah.
There's that feeling you get of,
I'm tired.
I'm satisfied.
Oh, you're satisfied. I thought people retire because they're tired.
No, it's enough.
Yeah.
Most doctors don't get that. That's why we see maybe 80-year-old doctors, professors.
I know of an amazing OBGYN in his 80s.
Yeah, they are still amazing.
He is so effective. Yeah. He is so active.
Yeah. So this guy has worked so many years.
Yeah.
And we just need to say, for your lifetime of good work, asante sana, Prof. Asante sana, Daktari. And that's what Top Daktari is all about. Top Daktari Awards. We're looking to make it annual. Yeah. And I hope you guys can join us in doing this. And it wouldn't be possible without you. So you guys should click the link down. We shall share it. Yeah. And let's get it rolling. Yeah, get there, nominate someone. Just follow. It's very pretty simple. Straightforward. Follow. Tick, jaza, press send. And then we will vote later. And then we will gather Sisi sote as a family of medics and present these awards and just clap for these people. Give them a standing ovation.
Let's
and
still
say,
do it in advance, especially the nurses right now.
yeah. And say, Daktari, a quick one recognizes you guys.
Okay, so we are wrapping up this episode. Tune in, same time, same place. I am your co-host, Liz.
And me. Oh, no, I used to love Shafi and Kalechi. Do you know those ones? You didn't grow up. You know. There was a time when we were teenagers and there used to be the rush hour. I love that show.
It's giving your professor when you're in university in the ideal setup.
No, it used to be the rush hour.
Okay.
And it was Shafi and Kalechi. Yeah. We sound like Shafi and Kalechi because it would be like, you're hanging out with me, Shafi Weru, and me, Kalechi Momo.
Leez Renske.
So this is Daktari, a quick one. You've been hanging out with me, Dr. Nyadimu.
And me, Leez Renske.
And it's adios.
Bye.